Welcome, everybody, to the Psych Crusader. I'm your host, The Expendable. So it has been it's snowing in Atlanta right now. I don't know if you guys are aware of that, but that we have snow, and I'm tired of it already. But in Atlanta yesterday, we had the national championship football game, Ohio State versus Notre Dame, which I'm pretty sure they're the ones that brought the snow down here. But I'm an Ohio State fan, so I'll take it and move on. So that's what matters. But today, so if you like my show, like, subscribe, and ding the bell. So what we're going to do today is we're going to cover the autism spectrum disorder. And this one is kind of close to me. This is something that's in my family. So I have a kind of a special place in my heart for autism. So just to define it, like I said, we pull all of our information from the Mayo Clinic. So if you don't like anything that I say, go sue them. So the autism spectrum disorder, and we'll probably just shorten it to autism or autistic. It's a condition related to brain development that impacts how a person perceives and socializes with each other, causing problems in social interaction and communication. So I think a lot of people that are around people with autism can easily see that part of it where, the child or the person, they have a tough time communicating with others in social settings. It becomes very awkward, and we'll talk about some of those symptoms here in a little bit. The disorder also includes limited and repetitive patterns of behavior. So they're very systematic. That's the best word that I can describe. They like their routines, and they do not like coming out of their routines. The term spectrum in autism spectrum disorder refers to the wide range of symptoms and severity. So that's why they call it the spectrum. It's because there's one extreme, and then there's the other, and then there's things in the middle. So it just depends on the person that that falls on the spectrum as to where you feel they would fit on there, whether they're just mildly autistic or whether they have a very extreme, and it's very easily identifiable as to which side of the spectrum they're on. So autism spectrum disorder includes conditions that were previously considered separate from autism, like Asperger's syndrome. So Asperger's syndrome is a condition that I'm very, very well aware of. My youngest son has Asperger's syndrome, and it took us a very, very, very long time to get that diagnosis because they do not like to diagnose children at a young age, but we always knew that there was something there. And I don't want to say that we knew there was something wrong, because there wasn't anything really wrong with him. Because I don't see this disorder as having something wrong. So with my son having Asperger's, we noticed it because he was always grouping things all the time. He was obsessed with it. Things had to be in pairs or threes or quads or whatever. He was always grouping things and color coding things. And he did have a tough time communicating in social settings. He would get confused and have easy anxiety issues. He would feel backed into a corner, and then as often as what happens with people with Asperger's syndrome, they'll once they get to a point where they can't protect themselves mentally anymore, they just lash out, and we would have behavioral issues that way. However, once we were able to diagnose him and identify what was really going on, and at that time I'd never heard of Asperger's syndrome, so I had to learn all this on the fly as a young parent and dealing with this child that had a condition that I wasn't sure what it was or how to deal with it. So it was a learning experience for me on my end of things, and definitely it had to be a learning experience on his part. But first, we had to understand what was going on, so that way we could find out how to treat him, and then teach him how, like, here's you just think a little bit differently than everybody else, but here's how to think. And one of the things, the little tools that I used that was very effective, when he would get upset, I would just talk like Yoda. And changing the structure of the sentence like Yoda does. And that worked phenomenally well with him. He responded. I had to basically jump into his mind and communicate on his terms. So that's a little trick that if you have a family member or a friend that's on the spectrum, try to, instead of trying to force them to come into our society, our neurotypical society, try to go into their mind where they're comfortable. It'll be easier to communicate with them if you go to where they're at. I promise, it's a lot easier. So Asperger's syndrome, one of the other ones, childhood disintegrative disorder, and an unspecified form of pervasive developmental disorder. Some people still use the term Asperger's syndrome, which is generally thought to be at the mild end of the autism spectrum disorder. So Asperger's syndrome is kind of a gray area now. They've redefined things and changed things, and now it's on the autism spectrum where before it wasn't. So you just have to kind of educate yourself on Asperger's and find out where that fits on the autism spectrum disorder. Whereas what the Mayo Clinic just noted is that people tend to believe that that's on the milder end of the spectrum, which I would probably agree with that. So autism spectrum disorder begins in early childhood and eventually causes problems functioning in society. Socially, in school, and at work, for example, often children show symptoms of autism within the first year. Very true. That's what I saw in my own child. A smaller number of children appear to develop normally in the first year, and then they go through a period of regression between 18 and 24 when they develop autism symptoms. So we'll talk about those symptoms here in a second. While there's no cure for autism, so it's once again, as if you follow the Psych Crusader show, you'll know that most of these conditions that we've already covered up to today have there's no cure to them. There's no magic wand that you can wave, or no medication that you can give that's going to fix this. Once they have it, once it's been identified to be there, it's not going to just go away. You're going to have to learn how to help the person that has it deal with society. Like I said, while there's no cure for the autism spectrum disorder, intensive early treatment can make a big difference in the lives of many children. That's absolutely true. The more educated you are, the more you can educate your child, the better off they're going to be in the future. I was lucky and we were able to get a handle on my son at a very early age, and he graduated with a 4.2 grade point average and is off being phenomenal in college right now. So, that's just a big thing. Early detection, understanding what you need to do, create a plan, run the plan by your child, and go execute the plan. If you show them a structure, they're going to respond very well to that. Kids on the spectrum love structure. They do not like spontaneous things. So let's go through the symptoms now. And I've got 5 pages in there, so it's going to be we're in for a show today. So some children show the signs of autism spectrum disorder in their early infancy, such as like the reduced eye contact. That's a big one. Generally, kids with autism, they avoid eye contact at all costs. They will almost look right around you when you're trying to talk to them, or they'll look down at you. Sometimes they'll even look up to the sky just to avoid eye contact. So they avoid eye contact. They have a lack of response to their name or indifference to caregivers. Now we're moving the spectrum a little bit more. Other children may develop normally in the first few months or years of their life, but then suddenly become withdrawn or aggressive, or lose language skills they've already acquired. Signs usually are seen by age 2. So right around the age 2, start paying attention to the behaviors of your child, and that way you can get an early head start on getting treatment plans and things put together. Each child with autism spectrum disorder is likely to have a unique pattern of behavior and level of severity, from low functioning to high functioning. Now, once you get that dialed in, it's going to be easy to know where the child's at all the time, because you're going to know where their kind of their baseline is at, and you're going to know where their extreme is at, and they're going to be very consistent with those levels. So you pretty much are going to see them at their normal self and at their extreme self. So it's going to be then pretty soon you'll be able to pick up on the things that kind of trigger them, and you'll be able to help them avoid triggering behavior. Some children with autism spectrum disorder have difficulty learning. Some have signs of lower than normal intelligence. Other children with the disorder have normal to high intelligence. They learn quickly, yet have trouble communicating and applying what they know in everyday life and adjusting to social situations. Like I said, my son was on the high functioning side. He was brilliant in school, struggled in social settings. He had an older brother that was a year older than him that kind of helped him in social settings. So that kind of worked out in his benefit, to where he was able to develop relationships with people and learn how to be friendly with people and have just regular average teenage relationships by watching his brother do it. So that we were blessed in that aspect of that. So I gotta move my cursor here. Because of the unique mixture of symptoms in each child, severity can sometimes be difficult to determine. It's generally based on the level of impairments and how they impact each ability, or impact the ability to function. So that's important. So you want to know what their function capabilities are. Are they high functioning? Are they low functioning? Are they somewhere in the middle? Where do they go? Where does their mind go? You have to follow their mind. You can't force them to come to you. You have to be in their world. I can't stress that enough. You have to figure out where this child is mentally and go there with them and help them guide them through this. It is very time consuming, but once you get it down, it'll be 100% worth it. I promise. So social communication and interaction. Let's talk about that with the autistic spectrum disorder. A child or adult with autism spectrum disorder may have problems with social interaction and communication skills, including any of these signs. So here we go. Fails to respond to their name, which we already talked about. Resists cuddling or holding and seems to prefer playing alone. Retreating into their own world. That is very common. That is a very, very easy sign. If they seem to not have empathy, generally children they develop this, like, they have that bond with their parents where there's an empathy there. Generally, the autistic children they won't have that connection like that. They'll be a little away from you as a parent, and that's usually when I think that's how we noticed the most with him, was he just was not a cuddly kid. He was very kind of distant and, was happy with just having a verbiage rather than the physical touch from parents. If you have poor eye contact, we just talked about that. Doesn't speak. Sometimes they don't speak, or they have delayed speech, or they lose previous ability to say words or sentences. That's on the more it could be on the high functioning and low functioning. So that one you have to kind of match the behavior with what's going on. They can't start a conversation or keep one going. It only starts one, like, to make requests or like point things out. So conversation is very difficult for them. They don't know where to start, or how do I talk to this person, or how do I comment on this to this person. So conversation is very difficult. They tend to be very short, where they just answer the question and then they're ready to move on to the next task. They're very task oriented. So if you ask a question, they're going to answer the question to complete the task, then they're ready for the next task. So if your child starts developing like a task-oriented behavior, then you know that we're looking at potentially something that's on the spectrum, and you should probably think about getting an evaluation done. I'm very task-oriented. I'm pretty sure it's a genetic thing, so which is common. If they speak with an abnormal tone or rhythm and may use a sing-song voice or robot-like speech, my son he talked like a robot all the time. He was very robotic. So that's another sign. Watch out for that. Repeats words or phrases verbatim but doesn't understand how to use them. The next one is doesn't appear to understand simple questions or directions. My son did, but he would ask 1,000 questions as to why am I doing this? Why is this happening like this? What is the point of this? So there was a lot of follow-up questions. Shauna, hello. Thanks for coming on my show. I don't know what face that is you're making. Tired face, maybe? But yeah, so we have that where my son was always asking questions. Yeah, I was getting questioned on what my motives were. He had a question for every task that I would give him. Well, why do I have to do this? I don't understand. Can you explain this to me? No, I just want you to do it. But then I have to remember, like, that's how he thinks. Each task has to make sense. If there's a piece of the puzzle missing, it's going to throw him off, and chances are it can trigger him. So I had to learn real quick, like when he starts to question things, he just needs to put a puzzle piece in. That's it. And so that made it a lot easier after the fact when we communicated and when he got a little bit older. The next one is doesn't express emotions or feelings or appears unaware of others' feelings. Yes, absolutely. Like I said, there's just the empathy is missing. They know they love in their brain, but to show it empathetically is very difficult for them. And it's often confusing. Like the child doesn't love you when in fact the child does love you. They just do not know how to physically exert that emotion. You're never going to be able to tell me that my child doesn't love me, because I know he does. Doesn't point at or bring objects to share interest. Inappropriately touches a social interaction by being passive or aggressive or disruptive, so they don't know where to balance their behavior in social interactions, so that can happen. It makes things difficult for them and the people that they're interacting with, of course. They have difficulty recognizing nonverbal cues, such as interpreting other people's facial expressions, body postures, or tone of voice. So that's the thing where they can't read the room, or they don't know the temperature of the room. They're not very good at that. They think so. They're the best way to explain it, like I said, it's genetic. It's an algorithm. And when the algorithm is not computing, then they have to figure out what is the algebraic equation that needs plugged in to the algorithm to make it compute again. That's the best way I can describe it in my own little nerd way. But that's where that's at. And that's where especially seeing my son, I know my son's not the same as everybody else's kid who may have autism or Asperger's, but that's how he saw things. He had to compute them. And it was like he used deductive reasoning a lot, to where he always wanted to increase his percentage of being correct. So he would eliminate things, and then he would try to create the algorithm or manipulate the algorithm somehow. I know this seems really mathematical, but that's how they think, or at least that's how my son thinks, because I think the same way. So it's all about computing. So generally, when they're in front of somebody, they don't understand that the person they're talking to is showing confusion on their face, or showing anger or sadness. They don't resonate that. And but as the older they get, on the more milder side of the spectrum, they will understand that. They will know as they go older, okay, that's what sadness looks like. That's what anger looks like. That's what confusion looks like. That's what, they'll just they'll figure it out over time. But after, at first, it's going to be difficult for them. They're not going to know how to react to certain people's emotional responses. So patterns of behaviors. A child or adult with autism spectrum disorder may have limited repetitive patterns of behavior, interests, or activities, including any of these signs. Performs repetitive movements such as rocking, spinning, hand flapping. That's very, very common. I mean, it was bro, I'm gonna tell you right now, before I get back into this, it was a super good day for me. Actually, I look at it, it was like a triad day for me. One of my favorite historical characters is Martin Luther King Jr. So it's Martin Luther King Jr. Day. Ohio State won the national championship, and Trump's president. So for me, that's the trifecta right there. I had a good Monday. My Monday was excellent. Shauna's Monday was excellent as well. She's a huge Trump fan. She just doesn't want to tell anybody. So let's get back into that. So when we're talking about the hand movements and the rocking, the spinning, the hand flapping, that is a very, very more mild to could potentially even be in the severe portion of the spectrum, because children with autism, that's their release, that's their tick. So when they're triggered, that's their emotional response coming out in a gesture. So you have to understand that when you're around a kid, John says I'm a liar, but when you're around somebody with autism and you're starting to see like some of these behaviors where they start rocking or they're spinning, or you see the hand flapping is a very common one. So is the rocking. If you start seeing these, then you know that this child is starting to become overwhelmed, and we need to figure out how to eliminate some of the triggering things that are happening. So, the next one is performs activities that could cause self-harm, such as biting or head banging. That's a common one too. A lot of autistic kids will exert their energy into biting. So be prepared for that. I've seen that many times over and over again. They also develop specific routines or rituals and becomes disturbed at the slightest change. We just talked about that. My son was really bad at that. I am like that. I do not like change. I like my routines. Once I get my routine set, I don't want to change it ever. I could do it for 75 years every day, which is, it's insane, I know. But all my wives will tell you that too. Like, don't try to do anything that's not already pre-planned, because he will freak out. And I do. And I try not to. I'm very conscious of it. Like, I'm always like, okay, there's a chance something spontaneous could happen in the next couple of days. So be ready. So I try to be ready. You can also have problems with coordination or have odd movement patterns, such as clumsiness or walking on toes. And you have odd, stiff, or exaggerated body language. Walking on toes is a big one. That is a huge sign. You start seeing, especially a young child, where they always walk on their toes. That's a pretty good indication that there may be a potential autistic situation going on. That is an easy one for me. I can spot those out a mile away. Is fascinated by details of an object, such as the spinning wheels of a toy car, but doesn't understand the overall purpose or function of the object. Another one is usually sensitive to light, sound, or touch, yet may be indifferent to pain or temperature. My son did not like loud, repetitive sounds. It drove him crazy. Another one, doesn't engage in imitative or make-believe play. That's true, because they compute so much, they don't understand make-believe. Make-believe doesn't have an algorithm. So it's tough for them to to quantify that. They can also fixate on objects or activity with abnormal intensity or focus. They also have specific food preferences, such as eating only a few foods or refusing foods with certain texture. My son was no different. He did not, there's certain things he just will not eat, and he only sticks to certain things. That's it. Boom. I mean, as he's gotten older, I think he's a little bit more open to things, but when he was younger, man, it was like, I can't eat chicken nuggets 10 days in a row, man. I can't do it. Hey, wife, chicken nuggets and macaroni and cheese every day. Okay. I got to eat something else once in a while. So as the children mature, some children with autism spectrum disorder become more engaged with others and show fewer disturbances in behavior. Some, usually like those with the least severe problems, eventually may lead normal or near normal lives, which my son does now. Others, however, continue to have difficulty with language or social skills, and the teen years can bring worse behavior and emotional problems. So you just have to pay attention and help kind of guide them through things and give them a better understanding. It's going to be a little bit different on the more severe ends of the spectrum because there's going to be a lot more work to do. But it can be done. You can create a somewhat of a functional world for them to be in. So signs that when you probably need to consult in a doctor, psychiatrist, or it's probably mainly an autism specialist. That's what we had to do. We had to go to an autistic specialist. So babies develop at their own pace, and many don't follow exact timelines found in some parenting books. But children with autism spectrum disorder usually show some signs of delayed development before age 2. We already talked about that. If you're concerned about your child's development or suspect that your child may have autism spectrum disorder, discuss your concerns with your doctor. It's important to talk to your doctor about it, to get the correct referrals, to get to the correct facilities that specialize in this kind of stuff. Don't just ignore it, because you're going to do your child a disservice. If you're concerned about your child's development or suspect that your child may have autism spectrum disorder, discuss your concerns with the doctor. I just said that. The symptoms associated with the disorder can also be linked with other developmental disorders. So signs of autism spectrum disorder often appear early in development when there are obvious delays in language skills and social interactions. Your doctor may recommend developmental tests to identify if your child has delays in cognitive, language, and social skills. So here's some of the things that they look for. It doesn't respond with a smile or happy expression by 6 months old. Doesn't mimic sounds or facial expressions by 9 months old. So they're finding the symptoms in very, very early developmental ages. Doesn't babble or coo by a year. Doesn't gesture or point or wave by 14 months. Doesn't say single words by 16 months. Doesn't play make-believe or pretend by 18 months. Doesn't say two-word phrases by 2 years old. Or they just lose language skills or social skills at whatever age. So those are things like, this is stuff, there's been a lot of study on autism spectrum disorder. So there's a lot of helpful information out there for you if you have someone in your life that is going through the spectrum. So it's very, very, they're starting to make it easier to identify these things as opposed to other disorders where the symptoms all kind of match up with other disorders, and it makes it very difficult to actually pinpoint what is exactly going on. Autism spectrum disorder is different because it's kind of unique. The behaviors and the triggers are kind of unique. So treatment, let's talk about treatment. So there's no cure for autism. There's no one-size-fits-all treatment. The goal of treatment is to maximize your child's ability to function by reducing autism spectrum disorder symptoms and supporting development and learning. Early intervention during the preschool years can help your child learn critical social communication, Functional and behavioral skills. I highly agree with that. We caught my son at a very early age, and everything turned out okay. So I agree with that. If you see the signs, try to get treated as soon as possible, or at least get a plan put together so that way you know what to do and you know how to help your child. It's not about the amount of work you have to put in as a parent. This child is going to need your guidance. They're going to need you to know what you're doing. The range of home-based and school-based treatments and interventions for autism spectrum disorder can be overwhelming, and your child's needs may change over time. That's facts. Your healthcare provider can recommend options and help identify resources in your area. If your child is diagnosed with autism spectrum disorder, talk to experts about creating a treatment strategy and build a team of professionals to meet your child's needs. A team. You're going to need a team of people to help you tackle this. So some of the treatment options, here they are. Behavioral and communication therapies, very, very common. I recommend that gets done. Many programs address the range of social, language, and behavioral difficulties associated with autism spectrum disorder. Some programs focus on reducing problem behaviors and teaching new skills. The child is still a child, and they still have the capacity to learn. So foster that learning experience. Give them that algorithm to work on, and they will. They'll work on it. They will learn. Other programs focus on teaching children how to act in social situations or communicate better with others. Applied behavior. You know anything about me? That's what my ex-wife does. She's an ABA therapist that can help children learn new skills and generalize these skills to multiple situations through a reward-based motivation system. Generally, and it's sad to say this, but it's almost like training a dog in some sense, where if they're doing a behavior and it's a positive behavior and you give them a treat, they will compute that as, hey, if I want a treat, I need to exert positive behavior, and then I know what the outcome is. If you don't keep up on that and it's hit or miss, that's going to confuse the child. So whatever it is, whatever tactic you use, you want to be consistent with it, and that way they know how the end result is going to be. They're going to have to compute that. If I do this, this happens. So educational therapies. Children with autism spectrum disorder often respond well to highly structured educational programs. Successful programs typically include a team of specialists and a variety of activities to improve social skills, communications, and behavior. Preschool children who receive intensive and individualized behavior interventions often show good progress. Facts. The earlier, the better, just like we talked about this whole episode. So you also have family therapies. Parents and other family members can learn how to play and interact with their children in ways that promote social interaction skills, manage problem behaviors, and teach daily living skills and communication. I didn't have that. I could have. I didn't do it. I wasn't smart enough to think that way back then. However, I'm telling you now, as someone who has been through this, you do want to go and learn from the professionals how to communicate with a child that's on the spectrum, because it is not like dealing with a neurotypical child. So I just kind of said, well, I'm going to broaden my imagination. And I just started talking to my son like I was Yoda, and it worked every time. And so he knew that I was coming into his mind, and he knew how to react to that. He was a Star Wars junkie, and he knew everything there is to know about Star Wars. So when I turned into Yoda for him, I was a character in the movie that was already playing in his mind all the time. So he trusted Yoda. So that made it easier. Other therapies, depending on your child's needs: speech therapy to improve communication skills, occupational therapy to teach activities of daily living, and physical therapy to improve movement and balance may be beneficial. A psychologist can recommend ways to address problem behavior. Problem behavior is going to be a little bit different than other types of behavior. So if they are exerting violence or aggression, then we need to come up with a different type of plan. I recommend a diversion, or because when they get into this aggression in their mind, it is going to be very difficult to rationalize behavior back to them. You're not going to be able to say, hey, you're being ridiculous. Hey, you're doing this. Hey, you're doing that. They're not going to rationalize that. The behavior's already set. It's already there, and it's going to happen. And so you have to just divert, just remove them from whatever atmosphere is causing the confusion. It's very effective. Yes, it's a little bit extra work you have to do, but it's beneficial, and you're going to be able to isolate that child away from the problem situations and get them calmed back down so they're back being functional again. Medications. There are no medications that can improve the core signs of autism spectrum disorder, but specific medications can help control symptoms. For example, certain medications may be prescribed if your child is hyperactive, or antipsychotic drugs are sometimes used to treat severe behavioral problems. So there are antidepressants, anxiety, they can treat the symptoms, but the actual disorder is not going to go away. It's always going to be there. They're always going to think that way. So the goal is to progress and let them self-educate, help them educate, and improve their mental capacity so they can identify their own triggers and start to sort of create their own evacuation plan so they don't get themselves into trouble. So eventually you're not going to be there to hold your child's hand as they're in their 20s, and they're going to have to know how to manage their own situation. So hopefully that's going to be beneficial to somebody, and you have a better idea what's going on. It's when you have kids and they're at that very young age, it's always a good idea to monitor them and evaluate them to know exactly, is there something going on there? What are their reactions to things? As the percentage of kids that are diagnosed with autism is going up for some unknown reason that I'm not going to talk about on this podcast. But there is some theories as to why the autistic rates are going up and Asperger's rates are going up. But that's for my other show, the Expendable Show. So just pay attention to your kids. It's highly important. We're not going to be able to parent correctly if we're not paying attention to their behaviors. So that is all that I have for today. Thanks everybody for coming in the the chats today. It's always one of my favorite parts to talk to everybody. And I will be back tomorrow with the Expendable Show, and we're going to go over some of the political stuff that happened in the last couple of days. So I'm out. Peace.